When you're in the nursing program, you will taking NCLEX style questions to better prepare you for your future exams. This video provides an overview of these question types.
All right, let's talk about the NCLEX. It's a huge deal, right? And one of the most stressful parts can be just wondering what's on the test. What do the questions even look like? Well, that's exactly what we're going to break down. We're going to decode every single question type you'll see, so you can walk in on test day feeling like you know exactly what to expect.
And yeah, if you're deep in NCLEX prep, you know the feeling. The pressure's real, and it can feel totally overwhelming when you realize just how many different kinds of questions they can throw at you. It's like just when you master one type, you find out there's a whole other format you've got to learn.
But don't worry, we've got a plan. By the time we're done here, you're going to have a crystal clear map of the whole exam. We're going to cover everything, from the classic multiple choice stuff all the way up to those brand new next-gen questions.
Okay, so let's dive right in. We're going to start with the absolute foundation of the NCLEX, the one question type that makes up most of the exam.
And this number might actually make you breathe a little easier. We're talking 80 to 90%. Seriously, that's how much of the NCLEX is made up of a format you already know inside and out.
Yep, it's the classic 4-option, single-answer, multiple-choice question. You've seen these a million times in nursing school, right? But here's the key difference on the NCLEX. They're not just asking you to remember a fact. They're all about applying what you know. They want to see you analyze a situation and pick the best action, or the very first thing you should do.
Okay, so now that we've got the foundation covered, let's look at how the exam builds on that with some other question types. These are the classic alternate formats. They've been around for a bit, but you absolutely still need to know them.
So you might run into things like these. They all need a different kind of answer. That fill in the blank? Yeah, 9 times out of 10, that's going to be a dosage calculation. No options, you just have to know the math. Or you might get a hotspot question, where they show you, say, an ECG strip, and you have to physically click on the part that shows the problem.
All right, now for the big one, the Next Generation NCLEX, or NGN. This is really the heart of how the exam has evolved. We're going to break down these new, more complex formats because this is where the test really digs into how you think like a nurse.
So the biggest change, hands down, is the NGN case study. Imagine this. You get a patient's electronic health record. It's got everything, tabs for nurses' notes, vitals, lab results, and your job is to click through it and work through a patient's situation as it unfolds. It's super interactive.
And here's how it's structured. Every single case study has 6 questions, and they're all linked together. Each question is tied directly to one of these 6 steps in the clinical judgment model. It's actually pretty brilliant because it's designed to literally walk you through the way a nurse thinks, from the moment you notice something is off, all the way to checking if what you did actually worked.
And inside those case studies, you'll find some really unique question types. This one is called the bow tie. It's a drag and drop, and your goal is to build the whole clinical picture. You'll drag the right actions to one side, the things you need to monitor to the other side, and connect them all to the patient's condition right there in the middle.
You're also going to see questions where you have to pick more than one right answer. You know, the dreaded select all that apply. But the NGN has a newer, friendlier version called Select N. This is actually great because it tells you exactly how many answers to look for. It'll say something like, choose the 3 most likely causes, which takes away a lot of the guesswork.
Then there are the highlight questions. This is another one where you get to interact directly with the information. You'll get a little piece of a patient's chart, like a nurse's note, and you just have to read it and click on the words or phrases that are the most important clinical findings.
And this one is all about prioritization. It's a drag and drop where you're given a list of nursing actions and you have to put them in the exact right order. It's a perfect way to test if you know not just what to do, but what you need to do first. And to round things out, the NGN has a couple other formats. You've got the matrix, or grid, where you're basically filling out a table with your answers. And you'll also see drop-down menus right inside a sentence or chart where you pick the right option to complete the thought. So, why? Why all these different formats? What's the point? Well, it all comes down to the way the test itself actually works. See, the NCLEX isn't just a simple list of questions. It's a dynamic, living thing. It's what's known as a computerized adaptive test, or CAT for short, and that's a huge deal. Unlike a regular test where everyone gets the same questions in the same order, a CAT adapts to you. It gets harder when you get questions right, and a little easier if you stumble. It's constantly trying to figure out your exact level of competence.
And that brings us to the most important point of all. None of these formats, not even the tricky next-gen ones, are there to trick you.
that's not the goal. The goal is to get as close as possible to simulating the real-world, complex, messy decisions you have to make every single day to be a safe and effective nurse.
So you see, the NCLEX isn't some big, scary mystery. It's a very carefully built test with a very clear structure. And now that you know the blueprint, you can stop just studying everything and start studying strategically. You can turn that feeling of being overwhelmed into a confident plan. So, which one are you going to tackle first?
Do you want to talk to a person about this or another topic? Just reach out to us. We can help you be more successful this semester.